Acute stroke is one of the leading causes of disability in the United States. The timely care of stroke patients is important, leading to better outcomes. Ischemic stroke occurs when there is a clot in the cerebral artery, which blocks blood to specific regions of the brain. This type of stroke accounts for 85% of cases. Hemorrhagic stroke may be due to a burst cerebral artery leading to bleeding within the brain or between the brain and its covering layers. This type of stroke is less common but often severe. Signs and symptoms of stroke include sudden weakness, primarily on one side, arm drift, drooping mouth or face, speech deficits including slurred speech, difficulty making speech, or using inappropriate words. The patient may have numbness or tingling on one side or both sides of the body, or may not recognize one side of their body at all. Hemorrhagic stroke patients may have additional symptoms, including a thunderclap headache or worst headache of my life. Because stroke etiology will determine care, it is absolutely essential that the patient get a head CT as soon as possible, within 25 minutes of arrival to the hospital. Rapid transport to the facility is key to preserving brain tissue. The CT scan can then alert providers to the correct course of action. The healthcare team should also perform an ECG, which should not delay the CT scan. Occasionally, in ischemic strokes, the atrial fibrillation rhythm will be present, which causes the clot to form and dislodge from the heart and into the cerebral arteries. One of the most important assessments in stroke patients is the last known well time. This is the time the patient was last known to be well and may be determined by a variety of factors. Time determinants are often unreliable from stroke patients who may be unable to communicate to providers. Often a time the patient was last seen normal or the time a family or friend spoke to the patient is used as a last known well time, which may preclude the patient from receiving treatment. It is important to do a thorough investigation of the last known well, because patients with a last known well greater than 4.5 hours are not eligible for fibrinolytic treatment. As with ACS, stroke victims may experience better outcomes if they can quickly be transferred to a hospital capable of performing neurological intervention. Here, specially trained interventionalists will remove the clot from the brain, resulting in reperfusion of the brain tissue. Brain tissue does not store glucose or oxygen, making it extremely susceptible to damage due to ischemia. Patients who have a suspected stroke should receive a CT scan within the first 25 minutes of treatment, which should be read by a qualified provider within 45 minutes of arrival. Stroke symptoms are established on a scale to determine a baseline for treatment. This scale may be as simple as the FAST scale, which looks at face, arms, speech, and time for initial triage or family observation. Experienced practitioners use the National Institute of Health Stroke Scale, or NIHSS, which scores items using a point system to determine the severity of the stroke. Regardless of the scale used, first responders should rapidly identify signs of symptoms of stroke and attempt to learn important information like last known well time and history, including recent strokes or heart attacks, and the use of blood-thinning medications. The door to fibrinolytic therapy should not exceed 60 minutes. Endovascular therapy should occur within 6 hours, but may be beneficial up to 24 hours after the event. Monitor patients closely for bleeding or stroke reoccurrence. Patients experiencing hemorrhagic strokes may require transfer to a facility capable of performing intervention for this type of stroke. In many cases, hemorrhagic stroke patients deteriorate rapidly. Emergency medical providers should anticipate the need for rapid transport and early intubation. Stroke symptoms of any kind are a medical emergency. Patients who experience stroke symptoms that resolve quickly or come and go should still be transported to the nearest stroke-capable facility or should be monitored closely if already in the hospital setting. These patients are much more likely to experience a stroke in the near future. Regardless of your patient's location or signs and symptoms, you can provide high-quality, advanced life support using the tools you have learned in this course. Patients are more likely to survive when high-quality basic life support measures are initiated quickly, followed by advanced support like airway adjuncts, medication administration, or electrical therapies. Follow your primary and secondary assessment protocols to determine the correct algorithms for patient treatment. Be prepared to change to alternative algorithms as the patient's condition evolves. You can provide life-saving care by employing the best practices in this course and by using great team dynamics and communication.